Namaste everyone. Welcome to all the Sakhis and Namaste to Raghuramji. I am Prabha Krishna. I'm the Secretary of Yoga Bharati, and today I welcome all the Sakhis for this wonderful event called WOW. So let's all join the WOW session, Well-being and Wellness of Women, which would be conducted by Dr. Latha Venkatram, a very popular gynecologist in Bangalore. And I think she's conducted a lot of international conferences and everything. So she's also a consultant and head of gynec in Rangadurai Hospital in Bangalore, as well as Vasavi. So she's just getting a little delayed right now, reaching home. So meanwhile, let's first sit comfortably, all of us. Let's be centered wherever you are, wherever you have logged in. So I hope you have logged in at home. Okay, so just sit comfortably, keep your eyes closed and be centered, be present in the moment. And how would we be present in the moment? By just observing ourselves, observing how your body is. Is there any tension in any part of the body? Check your shoulders, check your forehead. Have a gentle smile. Observe your breath. With all the sounds around you, you are being there and being aware of yourself. And observe the breath in and out through the nostrils. Through the tip of the nostrils, you're observing. And slowly and steadily, you're joining the palms together. Close your eyes, continue to close your eyes, and let's all chant one round of Om followed by Sahana Bhavatu. If you know the prayer, chant along with me. If you don't know, please listen. Breathe in. Om. Sahana Bhavatu, Sahanau Bhunaktu, Sahaviryam Karavavahai, Tejasvinavadi Tamastu Mavid Vishavahai. Om Shanti Shanti Shanti. Let's all bow down. Let us be grateful and let us pray for divine grace to be nourished today, to be enriched with all the knowledge we would be gaining today. Let there be peace everywhere. Let there be peace in our hearts. Om, peace, peace, peace. Gently come up. Blink open your eyes whenever you're ready. So good evening once more. Namaste. Those who have just joined now, and I see Dr. Latha also has joined. Just 1 second, just hold on. Let me just make her as co-host. Let me find her. Yeah. Yes. Yes, Lataji, you can also unmute. Namaste and namaste to Raghuramji. So,
namaste. Namaste. Sorry, I'm still traveling. Another couple of minutes, I'll be able to sort of come to my, go to my desktop. Okay.
yes.
Sorry about that. Yeah.
Sure. We will wait for you, and till that time, we will get some insights from Raghuramji then.
So that itself shows how busy she is, you know.
Yeah.
Yeah, we can.
Okay, thank you.
So Raghuramji, please share your insights about today. A lot of women have gathered here. It's a women's wellness. It's a wow. It's a wow shop, wow session. And when there are a lot of women together anyway, there is always a wow. So, right. So please talk, something from your end. What is holistic wellness for women?
Before I talk about that, Latha is one of the rare persons. She has done MRCP and also MRCOG. That means 2 membership programs that she has done. Apart from which, she also guides so many people to pass MRC OG. So that is the great credit. So being a practitioner is one thing, and also being a teacher is another thing. That rare quality that she has got, and she has wonderful students in any case. That's the thing. And more important thing is extraordinary, wonderful, great human being. Because basically Krishna says in Bhagavad Gita that there are this Devi Sapat, Asuri Sapat. Actually, I was thinking that women health, it's not just only limited to only women, but women qualities and men. That's also supposed to be part of it. And women, why women is something so extraordinary is because several qualities that are there, like endurance, patience, and then forgiveness. These are all the things which Krishna talks in the form of Daivi Sampat. That means to say the divine qualities that are there. In fact, if we nurture those divine qualities within us, that means to say we are contributing towards the women health within us. It's not just only the physical health. Of course, physical health is important, where the doctors will take care of it and all that. But very important thing is the psychological, mental, emotional kind of thing. In fact, I always keep saying that the bhakti path is supposed to be women path. That means to say it is the emotions which are very, very important for us. And it is very important to see that every member of the family to take care of the emotional aspect of the whole family. Then the family will be together. See, intellect only separates the people, whereas emotion is something which will bring people together, which will knit together. Another thing is emotion is something which can really excuse, differences and all those things, and respect, honor. So these are the things which are very important. In fact, you see that I always, envy in that sense, because I said, being a man, that what we do not realize the emotional aspect of it. The woman so naturally does it. It's not just only in India. I see this kind of an aspect anywhere in the world. Whether I go to Germany, Turkey, Italy, France, anywhere, I see that the womanly qualities are something which are enduring and ensuring, and then bringing them together, holding together. All these qualities are there properly, basically in the form of women. So, and that's why, the qualities of womanhood is something which is extraordinary. And another very important thing is that a family is together, a group is together. It's because that there are women forces who are executing that. Let me give you one small little idea that is there in the case of in Ramayana, that one aspect that comes very beautiful. All these 4 brothers of Rama, they come to Gurukul, and there a whole day that Vasishtha teaches them, and the evening, then when they are going to bed, at that time, Bharata says that without listening to the lullaby of mom, I can't sleep. Then Rama says, I'll sing for you, so you all sleep. So therefore that, okay, that's fine. Everybody is ready. But then suddenly, I think it's Lakshmana who had a doubt, saying that you will sing for all of us so that we will sleep. But who will sing for you? See, Rama is eldest brother, but it's not that too big. He's also a few hours only ahead of others. So Rama became very sad at that moment. Then Arundhati appears there, and she says that, Rama, I will sing for all of you so that you sleep. Then Vasishtha comes and says that, look, I'm teaching them to be disciplined, and you're spoiling them. And then Arundhati says that you did your job, let me do my job. This is very important. Taking care of emotions of the people, take care of the need of the people from the point of your heart is something which is basically very important contribution towards the emotional well-being or towards the women's health. That's something which is very unique, very important, that we need to take care of it. So once we do that, then I think a lot of things will be taken care of in the family, in the society, everywhere. That's what is very important. So in this session, probably that she will answer lot of things, because I mean, I don't think anybody who is such a great expert like Latha Venkatram is. I take liberty because we are so closely connected. So, and but she is definitely somebody. I'm very fortunate that to be part of our journey, part of this particular moment. And then she also helps me in guiding Yoga Bharati time and again and all that. So in that sense, that's very, in fact, last 1 month when I'm going through all kinds of health issues, it was Latha who was there with me, right by my side, take care of all those things. I really, I don't know, I have no words to thank her. Thank you so much. I'll leave it. Now Latha is there already. Okay.
Thank you very much, Raghuramji. I mean, people will be surprised that you were victimized by a gynecologist. So, hello? Yeah. So probably they would be quite alarmed that you had a gynecological, people would think that you had a gynecological problem or what. Okay. Okay. So sorry that I got a bit delayed and got held up in the traffic. But anyway, thanks to Raghuramji for keeping people engaged, and also thanks to my niece Aishwarya who could log in for me and keep things ready. Thank you. Okay. Am I audible?
Yes, Lataji, you're absolutely audible, and we are so thankful that you have come here, taken with all this rush in the hospital. You have come and going to give some wonderful, interesting. You know what I told everyone is your sense of humor. So we're all looking forward for a fun and wow session from you, and we welcome all the Sakis here to ask whatever concerns you have in the chat. So we would, Lataji, whenever she's
yes,
free,
absolutely.
she'll be looking into it and she'll answer at her pace.
Yeah, sure. I hope I won't bore you. Probably. I mean, I'm very glad that almost nearly 100 people are there. Thank you very much for joining on this Sunday afternoon, skipping your sleep or your shopping in the mall. Okay. Now, I'd like to just share the screen. Just give me a second. I'll just see whether my slides are ready. 1 second. So I'll just see whether, just give me a second. Yeah. See, Raghuramji was saying that women play a very big role, and emotionally they are different. So we are governed by lot of hormones. That's what makes us women. So we go through quite a few transitions in our life. That is menarche, pregnancy, menopause. All these are physiological changes that woman undergoes. Without us, the world doesn't exist. That, I mean, well, it's a privileged function of a woman to produce a progeny. Men can also say without them, the world doesn't exist, but I would claim more, I would claim that without women, men cannot exist, and also the world cannot exist. Okay. Now, wow, what is wow? Well-being of women. So all the women in the society, if there can be wow, it is lokaswasthyam, matruswasthyam, lokaswasthyam. So how do we make a woman feel like, wow, I'm fine? Okay, so let's just look at what are the things that a woman undergoes. As I already enlisted, menarche to menopause and beyond, how to be healthy and happy. Yatha mataram ashritya sarve jivanti jantavaha evam grahasthyam ashritya vartante itarashramaha. From Manusmriti, family becomes center of all human stages of life, just as the mother becomes the focal point of existence of all the beings. So we have already claimed that. So we are unique in having menstrual cycles. It is a programmed biorhythm, like hunger, sleep cycles. Menses is a manifestation of rhythm, synchrony, dynamic stability. So one should not be fed up of menstruation. They should, in fact, appreciate that the nature is doing the job for them, keeping their body in balance and synchrony. So it is a manifestation of dynamic stability. So it is a manifestation of coordinated functioning of many hormonal glands, starting from hypothalamus, that's the highest center in the brain, and also then pituitary, ovary, uterus. So unless there is a coordination, the functioning is, the menses can vary. So many people, including Professor Jeffcott, who is one of the premier gynecologists, said in the preface that menses is a reflection of mind. When I was a student, I really laughed at it and said, how can menses be a reflection of mind? But it is so. Women's brain affects periods. Even in the latest a publication in Nature, which is a very high-powered journal. So women's brain affects periods is sort of, I would say, proven in many different ways, by many different ways. So emotional cortex has a very big influence on hypothalamus, which produces a lot of hormones which control the pituitary, ovary, and ultimately the uterus is the one which says, look, all the hormonal glands are functioning all right. That's why I will menstruate. Okay, so that is what the uterus says. So if we have to be in homeostasis, our emotions have to be regulated, and all the other endocrine glands will be regulated by our higher centers. So that is why yoga has a very big role to play, because it has a big role to play on the mind. So the physiological changes that a woman undergoes, as I said, menarche, pregnancy, menopause, anything physiological associated with stress, it becomes pathological. What do we mean by physiological? It is so for every woman. Okay, it is the nature for every woman. But when stress is added on, these hormones can simply sort of go out of gear, and also our immune system can go out of gear, and it becomes disease-like. That is what we call as pathological. So let's look at some of the facts. I'm going to sort of run through different problems at different ages for women and how to maintain the well-being. That's going to be, that's why I said, wow, how do we keep ourselves through all the ages? Okay, so age of menarche is reducing. Some of the facts: abnormal if it is less than 9 years, beyond 15 years, especially without developing the secondary sexual characters, that is the hairs in the armpit down below, and also the breast development, it is abnormal. Periods can be irregular for 3 to 4 years after menarche. But if a girl is putting on weight, or if she is developing excessive pimples, or if she is growing excessive hair on the face, then you need to consult a doctor. Otherwise, it can be irregular for first 3-4 years. So beware of if putting on weight. So what are the menstrual problems that a woman can go through? Irregular menstruation, heavy menstruation, scanty menstruation, bleeding in between periods. All these are menstrual problems that a woman can go through. Coming to the adolescent that is the Polycystic Ovarian Syndrome, which is one of the commonest adolescent problems. I'd like to just say a few words about it. It is a multiple endocrine disturbance, that is hormonal disturbance, resulting in irregular ovulation, that is, and also affecting different systems in the body. There can be excess acne, there can be balding, there can be hirsutism, that is excess hair growth, and also obesity. These girls will have a terrible tendency to put on weight. Unfortunately, or fortunately, this is very much related to the lifestyle changes. There can be a genetic predisposition, but lifestyle change is one of the things that can trigger. So diet, exercise, stress, any of these or a combination of these can trigger the PCOS. So what if she gained a bit of weight, she can lose weight, or if she gained, if she didn't have irregular periods, didn't have regular periods, okay, so what? But I think it's very important to know it is a chain reaction and a vicious cycle. If the cycles are irregular, they will put on more weight. If they put on more weight, the periods will get scantier and more irregular. So it becomes a vicious cycle. So the treatment is mainly lifestyle change, but to bring them out of this vicious cycle, maybe the gynecologist will keep their periods regular, and also they have to try and lose weight. So it is the lifestyle change which is going to be of great importance in these girls. And malnutrition is not a problem in our country most of the time now. And it is malnutrition. We are going to the mall so much. We have so much of waste and no waste. So WAST is increasing, but WAIST is not seen, isn't it? So you would all agree with me. And people binge on chocolates. And I think I'm very angry with Amul because they have brought in so many types of dark chocolates. People think it is very good to have dark chocolates because it might make them lose weight. In fact, it is the other way around. It is like having strong cups of coffee. Even a small piece of dark chocolate it's like having a big glass of cappuccino, okay, because cocoa gets metabolized, getting converted into caffeine. So, it can cause a lot of hormonal imbalance also, and a lot of endocrine disruptive chemicals are there in our food, especially if people are eating out a lot of chemicals, preservatives in the form of preservatives, colors, and also stored food. All these can increase the EDC, that is an endocrine disruptive chemicals that we are consuming. So that can cause a lot of endocrine imbalance. That's why this is becoming more and more common in our country. And of course, stress, adolescent stress has become a major issue. Adolescent psychological issues and psychiatric problems are ever on the increase. But does it stop there? Unfortunately, this PCOS has long-term consequences. So cholesterol, high blood pressure, type 2 diabetes, cancers, all these increase in these women, and most of these occur less than 40, when they're less than 40, unfortunately. And quality of life, because they will be trying to lose weight, but they won't be able to lose weight, and obesity keeps it perpetuated. The PCOS gets perpetuated with obesity. So it is a vicious cycle, as I already said, and that reduces the quality of life. They will lack motivation, and also it affects their psyche. Not only it reduces their confidence and also the image, perception, etc. So this is a very big issue in adolescent age group, which the mothers have to be aware, and also the adolescent girls have to be aware. And I think it is important that we tackle it right at the root. And unfortunately, all these are again traced back to the womb, the intrauterine environment, which I'm going to mention a bit later. So mantra is lifestyle change. So how many of our girls are exercising regularly? How many of our girls are eating home-cooked food regularly? I think we have to ask these questions to our adolescents and educate them about what can happen to their health. So I think mothers play a very big role in bringing in lifestyle changes, and they should be the models. Okay. Premenstrual syndrome. Well, many people, others can mark our cycles. Okay. Many people go through this because again, it is, I mean, the symptoms can be from head to toe, 200 reported symptoms, I believe. So many of us have many of these in various cycles and also various phases of our life. Why does this happen? Because there is a normal change in the hormonal milieu in the last 15 days, that is after ovulation, a hormone called progesterone gets secreted, and there is an overreaction of the body and the mind to this hormonal change. So that results in premenstrual syndrome, where they can have many of these symptoms. Just few have been listed here. So it is again a physiological thing plus stress becoming pathological. So very well treated by yoga. So I think it is very important to understand these. Sexually transmitted disease, unfortunately, we have to put mind over matters. It is becoming very, very common, unfortunately. Most infections are curable, but all are preventable. Mind you, all are preventable. But once the girls get incurable disease, we might be able to get rid of their pregnancy, but we can't get rid of the disease, which can be permanent. So prevention is the best method. So you can see the fourth monkey I have put. So I think abstinence, chastity, everything is very, very important. It's a value for value that we have to bring in to our girls and also boys. Okay. Yeah. Continuing with the menstrual problems, normal menstrual cycle is 28 to 35 days usually, and 4 to 7 days bleeding is quite considered normal. It is abnormal if somebody is having less than 4 periods a year or less than 2 days of bleeding, or pain in the lower abdomen prior to periods, which reduces with the onset of periods, is quite common, but pain continuing throughout periods is abnormal. Okay, bleeding in between periods are abnormal. So wherever I have written as abnormal, they should seek a gynae consultation or a doctor's opinion. So continuing on, period problems. Our major chunk of our gynae practice is period problem. Nearly 80%, 70 to 80% of our consultation is for gynae problems. So it's such a common problem, but we don't have to get distressed about it. Not only the mind, which can affect the menses, but unfortunately, obesity is affecting the menses considerably in our country. 1 in 3 people are obese. And also in our country, the obesity is mainly upper abdominal fat. And also the BMI cutoff is lower for Indians because we see more metabolic problems at lower BMIs because of the higher visceral fat. We call it as upper abdominal fat is called as visceral fat, and that is the culprit which causes a lot of metabolic problems. And these can definitely cause period problems. It causes inflammation in all systems of the body. So these people will be more prone for diabetes, blood pressure, heart problems, cancers. Everything is due to the inflammatory process, which is kept burning by the fat if we did not burn the fat. So somebody said, well, I can't be bothered, doctor. Anyway, fat will be getting burnt ultimately. You understand me? Fat will be burnt ultimately. That is when one pops off. But I think it is very important to keep ourselves healthy and talk about burning the fat before we are burnt, and it burns us out. Okay, so it's very important that we are aware of this. And also, yeah, it's not an uncommon scene, isn't it, in the city nowadays? Okay, and even girls with school bags, you see this sort of picture. Okay, now moving on to the other problems like heavy menstruation, painful menstruation. Heavy menstruation, one of the common problems that one can have is fibroids. Fibroids are nothing but gritty mass of tissue in the musculature, from the musculature of the womb. Okay, so it can be coming into the cavity where the bleeding can be heavy, or it can stay within the musculature of the womb, or it can be growing out of the womb like a cap. Okay, so I think it is very important to know the potential for fibroids to turn malignant is 1 in 1,000, whereas the potential for having breast cancer is much more, 35 in 1,000. So if somebody had fibroids, it doesn't mean to say that they have to get rid of the womb. If you had a thorn pricking your toes, would you remove the thorn or remove the toe itself? It sounds like if somebody is going to go through hysterectomy for fibroids, it's like removing a toe. If there is a thorn, you have to remove the thorn. I'm not saying that we have to remove the fibroid, but we have to treat the fibroid. That's all. You don't have to treat the fibroid in more than 50% of cases, because more than 50% of them are asymptomatic. They won't have any symptoms. This is a what can I say, genetic predisposition, and also inheritance. We have inherited the properties because of our what can I say, Asian and African lineage. Okay, so we don't have to worry about it. So when fibroid can cause heavy menstruation, fibroid, if it grows big, it can press on the bladder or the bowel, then only we need to do something. Or it can, if it grows huge and if somebody is looking pregnant, probably that is another thing. Okay, nowadays it is very difficult to differentiate between pregnant and non-pregnant because of the increased WASTE circumference. Okay, so now, I mean, one of the pregnant women asked me, doctor, my tummy is not showing up. I said, it is fine, but compared to others, my tummy is not showing up. I said, without pregnancy, many people are showing up with their tummies, so you don't have to worry. That is, I think, yeah, that is a word of reassurance that I had to give her. But anyway, yeah, endometriosis is, moving on, endometriosis is another thing which actually it is supposed to be a disease which due to imbalance in the immune system. So endometriosis is the lining of the womb, the cells from the lining of the womb being present outside the womb, on the ovaries, on within the musculature of the womb, or outside in the pelvis. Okay, it can cause heavy menstruation, painful intercourse, and also sometimes pain during bowel or bladder emptying, and also excessive bleeding, as I said. So this is, in every woman, there is a backflow of menses during menstruation. So the cells usually get scavenged by the immune system. If they are not scavenged properly, due to the imbalance in the immune system, these cells get deposited, and every time a lady menstruates, these also menstruate, producing a lot of pain and a bit of gooey substance, which is spilled in the pelvis, and it doesn't have the place to come out. So endometriosis is, again, yoga can treat endometriosis to a great extent because it has got the property, or effect on the immune system to bring in balance. Yoga mainly brings in balance. We are talking about imbalances which the woman faces, and how she can alter it with lifestyle changes and also yoga. I'm emphasizing on those conditions, but actually most of them boil down to such, come under such category. Sorry, somehow, yeah, the slides are not moving for whatever reason. Aishwarya. Please. Yeah.
Doctor, you were mentioning about endometriosis,
Yeah.
imbalance in the immune system. So
Yes.
medically, it's through medicines it has been treated, is it?
Yeah, medically, we try to shrivel these cells which are spilt in the pelvis. We sort of try to abolish the ovulation and take over the control of the ovarian hormones. And we use mainly progestogens to shrivel these cells. Okay. Or sometimes there are what are called as chocolate cysts of the ovaries, because the menstrual fluid-like thing accumulates in the ovary, which can look very chocolatey. So they are called as chocolate cysts of the ovary. So they might have to be drained, and also we might have to remove the lining which is producing this sort of chocolatey fluid. So medical and surgical treatment. But I think doing yoga is very important. Again, this problem is related to lifestyle. Yeah, I keep joking, more chocolates, more chocolatey fluid even inside. So, I mean, that's just as a joke. Again, scientific literature about chocolates and chocolatey fluid is not there. I'm just joking because, yeah, diet is very important. So, moving on. Is there anything else that people want to ask me? I will briefly talk about white discharge a bit later, but is there anything that even without any of these problems, there can be increased menstruation, or if they did not have regular periods, the period can be really heavy. That is again due to hormonal imbalance, and also many a times if they have undergone stress. For example, during COVID time, we had lots of women coming for online consultation with menstrual issues without any problems in their uterus. It is just a manifestation of hormonal imbalance because the hormones are controlled by the mind through the hypothalamus.
So, Doctor, there's one question here.
Yes.
It's been asked in YouTube.
Yeah.
Generally acceptable BMI, I think, is 25. You have mentioned it is less for Indian women.
Yes.
I may have missed it, but could you let us know how much is acceptable for Indian women?
Yeah. Okay, good question. 23 to 25 is already overweight. BMI of 23 to 25. Okay, about 25, they are supposed to be obese. About 32, BMI of 32, morbidly obese. Okay, so compared to the Western counterparts, morbid obesity, they talk only after a BMI of 35. Okay, and mild, moderate, severe, 25 to 28 is overweight, whereas here for Indians, 23 to 25 is overweight. Okay, so I think it's very important to realize that it is the visceral fat which causes a lot of problems, and the Caucasian counterparts, though they are heavy, they might not have increased visceral fat disproportionately like us. Okay. Does hypothyroidism affect periods? Yes, it can cause heavy periods. Okay. Again, menses is a reflection of coordinated effort of many hormones, including thyroid and also adrenal. Adrenal is cortisol, the stress hormones, etc. So it is not only hypothalamus which gets affected by stress, but it is the adrenals also which can get affected by stress. So it is an orchestra. If there is an apaswara, the orchestra is not melodious. Similarly, menses. Okay. Now, is there anything else?
Nothing else, doctor, right now.
Yeah. Okay. Just 1 second. Yeah. Few words about pregnancy. No single period in human development provides a great potential for long-range payoff via a relatively short-range period of enlightened metabolic manipulation. See, the fetal programming is an amazing thing. The mental and physical development of the baby depends on the mental and physical well-being or the health of the mother. And she provides intrauterine atmosphere by being a healthy atmosphere, by being healthy and happy. That's why always in our ancient literature, they said for good quality progeny, the mother has to be happy. And also they believe that intrauterine learning happens. Yes, these have been scientifically proven. And if somebody wants to have the best, they have to give the best during pregnancy. Even prior to conception, they have to give the best. Because by the time they miss the period, the formation would have already started. So they wouldn't know which cycle they are going to conceive in. So it's very important for them to make sure that even pre-pregnancy, when they start planning, they should have a good lifestyle. Physical, mental health and happiness is very, very important for a quality progeny. As I said before, the obesity and also the PCOS, etc., all these get determined in the intrauterine life itself. Then when it is a continuum, actually, the health, mental and physical, what the fetus had in the womb after birth, it's not going to suddenly change and develop something else. No, it is continuing. So it depends on what atmosphere we give, not only in the uterus. In the uterus, 98% of the fetal programming happens. So it's so very important that first 9 months, how the first 9 months shape the rest of your life is a very important topic that the medical science is looking at. So if you want to give the best, if you can see the fetal programming, It's maximum during the first few months of life, few weeks, in fact. And once that is passed, you have a very small opportunity up to the age of 2 to change this hardware. Okay. If the hardware is not properly manufactured, any amount of software that is afterwards, you try to do so many things. You want to sort of make them learn this, that, and the other, keep them mentally happy, etc. Might not work. So if one has to do something, give the best, get the best, they have to give the best during pregnancy. All sorts of problems, that is coronary heart disease, hypertension, obesity, diabetes, attention disorders, autism spectrum, everything is being traced back to the womb. That again depends on the maternal and maternal physical and mental health, which has altered the intrauterine atmosphere in a positive or negative way. So whatever ancient literature said about the mother being the main person who determines the health, progeny's health, is very true. And also paternal health also matters. I'll just put up a slide for you briefly, just to make sure. Sorry, I don't know whether, anyway, paternal obesity also affects the progeny's health. So it's very important that both mother and the father are at optimal health when they're trying for a progeny. And also throughout pregnancy, they have to help each other to keep themselves, keep the mother happy. So it is what happens in the womb lasts a lifetime. So we should make sure that the pregnancy is well planned and the mothers or the couple are at optimal health and they remain healthy throughout pregnancy. That is the best fixed deposit that one can put for their child. No amount of money, no amount of extra schooling, very special schooling, etc., is going to help if you have not given the best. It might help to a small extent, but I think where we have to concentrate is this portion, the first few months of life. So tracing it back to the womb, as I said, it starts in the womb, diabetes, hypertension, etc. Adverse experiences during critical periods of growth, prenatal, childhood, and adolescence can determine the health of an individual. These are all affected by fast pace of urbanization, consequent epidemiological and nutritional transitions. So earlier age and disease progression at a faster rate in developed and even developing countries, which is very unfortunate. So mother's nutrition matters, body composition matters, stress levels matter. So all these can be altered by lifestyle changes. Okay, and also smoking, alcohol, substance abuse, mind over matters. Exposure to chemicals and toxicants, we might not be able to sort of do very much if it is atmospheric, but what we ingest, I think one has to be cautious. All these reduce the complications of pregnancy. If you are careful, if you have altered your lifestyle for better, the complications of pregnancy are much less and the quality of progeny is much better. So diabetes begets diabetes, obesity begets obesity. It's like saying, ni dapa, ni mama dapa, ni mappa dapa. It's not classical music, but people think that ni mama dapa, adrinda na dapa, ni mappa dapa, adrinda nin dapa, antanta. So that is not the way it was, because it is the intrauterine atmosphere. It is just not the genes. Okay. I think preconception, planned pregnancy well, physical and mental health, managing pre-existing or long-term conditions, previous pregnancy conditions, all these are very important. Folic acid supplementation is also very important. Yeah, I talk about influence of father, elevated the BMI and unhealthy diet habits, reduce sperm motility and increase sperm abnormality, impairing the offspring's health also. So pregnancy care, it is very important to make sure that the mother is mentally and physically healthy and happy. Adequate and not excessive weight gain is very important. You're not going to eat for 2, and if you had twins, you are not going to eat for 3. So, and also promoting vaginal delivery. This is becoming a rarity. Why do we have to promote vaginal deliveries? Because the gut microbiomes get programmed during the passage of this baby through the birth canal. So mode of delivery influences this microbiome, that is the gut microbiome, that is the gut, what can I say, the immunity, which brings in, these microbiomes are the ones which bring in the gut immunity. Gut immunity is 80% of immunity is gut immunity. And it is very important. These microbiomes are very important to prevent diabetes, hypertension, all these metabolic problems developing. So it's very important that the baby passes through the birth canal, and the whole world is shouting at the top of, even WHO is shouting at the top of its voice, saying that please, for the quality of progeny, we have to promote vaginal deliveries, and the cesarean section rates should not be more than 15% at the most. But the ratio is unfortunately reversed in India, especially in Bangalore. So it's very important. It is baptism. We call it as baptism at birth. Okay. So very, very important to have a vaginal delivery as far as possible. Okay. So if it is not possible, of course, yeah, but most of the time, 85 to 90% of the times, it is possible. And so we have to nurture our children right from preconceptional phase of a woman's life. So better maternal health, better progeny. And better progeny, if it is a female child, she will produce better offsprings. So matra swasthyam, locus swasthyam. That is how the health gets perpetuated, both mental and physical, for the betterment of the progeny, family, nation, and the world. So give the best to have the best. Another word of caution, if somebody has developed diabetes during pregnancy, they have 50% chance that they can become diabetic in the next 5 to 10 years. Okay, if somebody has developed blood pressure during pregnancy, it is important to know that 50% of them can develop blood pressure problems in the next 5-10 years of their life. If somebody is obese, they can continue to be obese and develop metabolic problems in the near future. Mental health issues, if somebody has had postpartum, postnatal, post-delivery depression, they are more prone for mental health problems. And if they have had PMS, that is pre-menstrual syndrome, they are more prone for mental health issues. See, it just shows an imbalance, excessive reaction to a particular physiological change. So if we have excess PMS, we would do probably more of yoga and more of our mind training so that you can prevent mental health issues coming up in pregnancy, and also mental health issues coming up around the time of menopause. Nature provides lots and lots of windows of opportunity. Pregnancy is a very big window of opportunity. And also nature provides lots and lots of backup. We should not be abusing and accusing nature. So, well, yeah. So that's about pregnancy. If somebody had any questions, probably we should just take it, Prabha, if you don't mind.
Yes, yes, doctor. Somebody had a question about PCOS right now. So I thought before you move on
Yeah,
to
sure.
menopause, I thought we can cover that. She's asked that in a teenager who has PCOS, apart from diet control and exercise, what other things to keep in mind?
Diet and exercise. See, if she's not having regular periods, I think it's very important to keep her periods regular, so that will also help in reducing weight. That is one thing. And it is important that we screen these children or adolescents for thyroid problems, diabetes, and also look at their lipid profile. These are few things that I would like to say, apart from encouraging her to be mentally healthy. Diet and exercise, but combined with yoga. I would say combine it with yoga, please. Because if you want the child to diet, girl to diet, it's not easy. The mind won't listen. You have to sort of motivate them. And it's not easy to bring mind over matters. Yoga is one technique, is a beautiful science where this technique of mind over matters, manav prashamanopayaha, chittavrutti nirodha, all these are brought in, okay, in various practices. I think it's very important that, for example, I keep telling my girls, my adolescent patients, 3 days of gym, 3 days of yoga, and one cheat day. Otherwise, it becomes very frustrating for them, and they will be cheating all the time. So if we just say one cheat day a week, that is fine, and we encourage them to eat whatever they want to, it can be very frustrating. So please give them lots of support, lots of encouragement, and also boost their morale, because image is, if they're obese, it's a body image is one of the problems with the girls, but unfortunately it pushes them into depression rather. So watch for mental health issues also. These are the things that I would like to say. Yeah.
And someone has written about that if a mother has a first child at the age of 38 years, I don't know what is NVD.
Natural vaginal.
Okay, but lot of PPH.
See, PPH is postpartum hemorrhage. That is the uterus which has ballooned out like that. The nature has to contract it to a cricket ball size uterus once the baby and placenta are expelled. Okay, it is truly not related to the age per se. Okay, so I think it's very important to note that PPH doesn't occur just because of age. It can happen in 5% of women. We might have to give them medications, etc., etc. But even during section, PPH happens more commonly, but the lady is not aware because she is not in control of what is happening. So delivering at 38 years, natural vaginal birth, PPH, I wouldn't, I would say it can happen to anybody, and it unfortunately has happened to you, but you're, absolutely fine to be asking this question, I'm sure.
Yes, she's asking if the same mother, that is the same mother who had this 36 years, can have a second pregnancy at 46 years. Is it, will it have any complication to the mother or the child?
Yeah, later the pregnancy, more health issues for mother can come up, because after all, we are going, I wouldn't say totally against nature, but that is, as we age, the ovaries also age and doesn't allow us to conceive easily. But if we have forced the nature in a different way, that is by ART, or even if it is a natural conception also, the chances of diabetes, hypertension, etc. is more common in these women. And also the chances of the baby having structural problems, 99.5% of them can be detected on the scan. But one of the things that is more common with aging is Down syndrome. We might have to have special tests. And if the same lady has had PPH before, there is extra 10% chance that she might have PPH again. So she will have to let the obstetrician know about it. So I'm not saying at 46, you should not be having children or conceiving, but you have to imagine yourself that at 50, when you're going through menopause, if you're having a 2 or 3-year-old child, how are you going to manage yourself and the child? So it's just not the question of having children, but how you're going to cope with yourself and the child, and of course, the family. If there are other members, how are you going to cope? Whether it's going to affect the mental and physical well-being of others and social well-being of others should also be considered.
So, doctor, just before you move on, one more question, because many of the women here would have had a C-section. So, one question has come there is, if I've had a C-section, does that mean that my child or myself would have less of gut microbiome, and would it affect my child's health in the future?
I mean, this is a question people, when they have had section, they keep asking. See, it is not for you that you have to have a vaginal. Of course, the gut microbiome doesn't matter for the mother. That's how I should put it. She would have been programmed when she was in her mother's womb, but it is for the progeny that we are programming the gut, rather nature is programming the gut microbiome. Yes, there have been studies that, I mean, please don't think that your child is not going to be all right if born by section, but the chances of immunological problems like asthma, eczema, other autoimmune disorders are more common in children who are born by cesarean, that is proven. And also the IQ, the behavior, etc., are better when they have moved through the birth canal. Why do we say that? Because gut is the second brain. There is a lot of communication between the gut neurotransmitters and the brain neurotransmitters. So it makes the brain work better if the gut microbiomes are better. That's what has been said in Ayurveda, not in these, not in this language, but that's what they have said. Yeah, whatever you eat, it matters for your brain. How does it matter? Because there are neurotransmitters. The science has proven now. So I'm not saying that your child is going to be of terribly inferior quality or anything like that, physically or mentally, but definitely it has been proven or shown that they have better health, mental and physical. But if you have had a section, what are the problems for you in future if you wanted to have another child? Every time we open up, I mean, it can, if you wanted to have a vaginal delivery, it becomes a higher risk labor. And also every time you have a section, when we open you up for anything else other than section also, 6 times more common, more chances of bleeding, infection, and also injury to other viscera like bladder, bowel, etc., etc. So it is best to go with the nature unless you're unable to deliver vaginally. But that should be around 10 to 15%. That's what the world, what can I say, the international bodies recommend. So if you can avoid a section, it would be very good. But please don't worry and say, look, I missed having a vaginal delivery. And at least, yeah, another this thing is, if the baby has gone through the birth canal to whatever extent, and you have tried a attempted vaginal delivery, that also will help gut microbiome programming. Not that you have to completely deliver vaginally, but it would be fantastic if you can deliver vaginally. But that also will give some amount of programming, gut microbiome programming. Okay, thanks.
So, doctor, people are eager to know about menopause. There are many people.
Yeah,
So, move on to
sure.
menopause, and after that, come back again for any questions.
Yeah, sure. So, brief word about white discharge. Yes, people should have white discharge. Even postmenopausally, they will have a bit of white discharge, but much, much less. When do we call it's like secretion in our mouths, tears in our eyes? We have to have vaginal secretions or discharge, otherwise the vagina gets dried up. So it's very important to have a discharge, normal discharge. It normally increases prior to periods, but also 2 weeks later, excuse me. And it's abnormal if associated with itching, irritation, if it is blood stained and copious. It is not the cause for backache. Okay, many people come for consultation because they are having white discharge and some backache. By backache of late, it is most of the time due to weight gain, abnormal weight gain, that people are having more and more of backache. So cancers, just a word about cancer: cancer of the cervix, cancer of the ovary, cancer of the uterus, breast cancers, all these are special for women, unfortunately, and cancer of the vagina and vulva are very rare. So only prevention for cervical cancer, you have cervical vaccine, best given before the girl becomes sexually active. Okay, promiscuity is increasing and the age of being sexually active is coming down very much, unfortunately. So I think they will have to be vaccinated in the pediatric age group, even in our country, unfortunately. So anyway, smoking, alcohol, weight can increase the incidence of all these cancers. So beware and beware, be aware. So weight reduction is very, very important. So lifestyle changes, again and again coming back. HPV vaccine, as I said, it should be ideally given before a girl becomes sexually active. After getting married or they become sexually active, still there is protection. So people can take it up to the age of 45 in India. People do recommend vaccination. This is the only vaccine which is preventive of cancer. So breast cancer, mammography by 40 or by 50 at the most. If you had family history of breast cancers, please get it done. Get some form of breast screening done. Even ultrasound mammogram can be done. It need not be a digital mammogram, which people fear because of the pain that they can undergo when the breast is put between two plates and squeezed for better pictures. So anyway, self-breast examination is very important. Please do it after the periods if you're menstruating. If you're not menstruating, first of every month you should be examining, because you can detect the changes much earlier than any doctors can do. Okay, so ovarian cancers, no screening, difficult in diagnosis. If there is a family history of ovarian cancer, you would need more screening and you need more counseling regarding how to screen yourself, etc. But once a year screening of the ovaries is better. So stress and emotional problems are much more with IT. All pain and pains of IT itself can be a topic. I think lifestyle change again is very, very important. The middle and reproductive years, take care of yourself first. Career, family, children, etc., etc. I think they would have bogged you down, and the hormonal changes which occur during menopause can bring in a lot of stress and anxiety. It can lead to a lot of issues, family issues, marital discord, etc. Menopausal symptoms in Indian women, we have done quite a few studies. The urogenital symptoms are the commonest in Indian women, actually. that is vaginal dryness is quite common. People might not complain. And also urination, frequent urination, urgency, and also they start waking up at night. And also they can have symptoms from top to bottom. Okay, vasomotor symptoms, that is hot flushes, night sweats, sleep disturbances, confusions, forgetfulness, all these. I'm sure many of us would have experienced that: muscle and joint pain, irritability, tiredness, palpitations, headache. I mean, you can go on listing and listing and listing. And in a reduced interest in sex, dryness of skin generally, and also weight gain in the center of the body. There is a central redistribution of the fat that is mainly on the chest, abdomen, and also the hips. Where you don't want the fat, you start putting on a lot of fat. That is due to the hormonal changes. So very important to check, get yourself checked, especially blood pressure, the thyroid, and also diabetes. It's very, very important to check for these because suddenly metabolic problems can appear. After all, menopause is a metabolic event. And if you're under stress, suddenly the other hormones can also change and lead to all these problems. The long-term effect of menopause is, or hidden effect of menopause is, the brittleness of bone, and also heart problems. So one has to check for bone density, especially if they have had fractures, if there's a family history of osteoporosis, if they are bent over early, or their mothers or sisters are bent over early in life. All these indicate osteoporosis, that is brittleness of bone. So it's important that they are aware of these, and it's important that they maintain a healthy diet, because there will be a lot of mental changes, um, uh, that is irritability, depression, sleeplessness can lead to many other symptoms also. So I think it can be a stressful period. As I said, anything physiological plus stress can become pathological. Husband would have probably reaching retirement age, okay, so can be more demanding. And the most of the time, the children will be adolescents, or teenage, or young adults. So a lot of compatibility issues can also bring in a lot of stress. So and also parents might be going through health issues, or in-laws might be going through health issues. So all put together, menopause might not be easy for a woman to cope with. So it's very important that we understand that we are going through a change, and we need support from husband and also the family. But once you understand menopause, you will be able to cope better, and you wonder whether you're going to get over this problem or you're going to sink. Many people get into a lot of anxiety or even depression, and sleeplessness can trouble them enormously. So these are the few things that you have to and we don't want to give hormones. As gynecologists, we really don't want to give hormones to every woman. You have to bring in some lifestyle changes to just support you. Maybe we will give you some vitamin, mineral supplementation, isoflavones, that is what is there in soya, a concentrated form might be given. Alternative systems of medicine, I mean, Ayurveda, homeopathy, Siddha, all these can help. I think it is, again, we have to put our mind over the matter. Matter is the body. Okay. So mind over the matter is very, very important. So aim of management is adding life to their years. It is not just lifestyle change. We have to add color to their life, adding life to their years. So it's very important that you keep yourself active, do regular exercises, regular yoga, and healthy diet. No junk food. Junk food can really make the menopause worse. Plenty of fruits, vegetables, water. That's what I keep saying. Carbs, cut down on carbs. Okay. So, and we can say me no pause. Okay. Or men oh pause. Okay. So both ways, I think we have to say men oh pause and me no pause. We don't have to pause. We can continue with our activities if we know how to manage. So stress can bring in all these problems, especially around the time of menopause. Make sure that you check for diabetes, blood pressure, weigh yourselves regularly. And if you are taking a lot of salt in your diet, please reduce smoking, alcohol cessation, etc. Very, very important. Thyroid problems, I think you have to have, I won't say supplementation, food. I would say probably some vitamin mineral combination will give you selenium, zinc, etc., which might make you a bit more healthy, make you feel a bit more healthy. So can't really prevent many times because of the environmental or endocrine disruptive chemicals. So I think cholesterol also can suddenly come up because of the weight gain. Unfortunately, you can see that you should not, you have to make sure that you don't progress in the spectrum. And in the later years, unfortunately, in India, these later years have received very little attention, and many women present only with medical problems. But so we have lost the opportunity to prevent these problems. Must create opportunities to promote healthy lifestyles and decrease the likelihood of the early onset diseases such as osteoporosis, cardiovascular diseases, fractures, dementia, etc. So prevention is very, very important, and cure can be far-fetched. So the mantra remains to be lifestyle change, lifestyle change. I think, yeah, I don't have to tell you about what to eat, what not to eat, but unfortunately, it is like Duryodhana. Janami dharmam nachame pravrittihi, janami adharmam nachame nivrittihi. So even if I know what is right, I cannot follow it. Even if I know what is wrong, I cannot give it up. So let's not do it with that diet, the diet. I think it is very important that we prevent our progeny from progressing like this, and eat well plate any it is very much available on Google, so you can have a look at it. A healthy, balanced diet. Not everybody needs to go through a dietitian or be under a dietitian. I think it is just reducing the carb, increasing the fiber in the food with a bit of increase in protein would do you a lot of good, and 2 to 2.5 liters of water to wash out the toxins. I think it's very important. And also, I really cannot overemphasize the value of yoga. It is so very important to inculcate. It is not, it's the lifestyle change that we need to bring in, but it is for life that we practice. Okay. And let it be a starting point for achieving many more higher things in the direction of Paramartha. So, physical activity, 150 minutes of moderate intensity activity. So 1 hour of walking at least for 5 days a week. So yoga, mindfulness, reducing stress, and recognizing depression, anxiety, stress, all these are very important. Family time. How many people, I mean, we keep messaging each other from one room to the other. We don't even have that human touch, human interaction. Are we right? Are we, I mean, should we not be having family time? And also, if you want to inculcate value for values, I think we should have family time. And nobody better than a woman can do this. I think it's very important. If you want to promote culture, you have to give quality time. If you want to promote health and happiness in the family, you have to give family quality time. So, and also practicing yoga, the whole family can be practicing yoga. Lifestyle modification, I have talked about it enough and more. Slow down, keep calm, be positive, take it easy, breathe, have fun, enjoy life, keep smiling, relax. That should be the mantra for a woman all through her life, because we are faced with more challenges than men, I would say, both physiologically and otherwise. So I think it should be, lifestyle should be a life course approach, and yoga helps enormously, and mindfulness is very, very important. What are we doing? What are we thinking? How are we behaving? All these are very important for a woman to keep herself calm, smiling, happy. So, right. So never give up. Great things take time, but will happen. So with this, I would like to conclude my lecture. It has gone on for quite some time. So yeah, I have.
There are questions, Doctor. There are.
I will take it up. Thank you very much for your patient hearing. We will take some of the questions.
Yes, Doctor. Shall I screen it and take it for you? Shall I ask the questions for you?
Please do, please.
Okay. So one person has asked, Sujata Ramesh, that even if the periods is continuing, if within 54 years also, is that okay? Because doctors say it has to stop by 50.
No, not really. Okay, if you had more number of follicles in your ovaries, you can menstruate for longer. Yes, understandable. Average age of menopause is around 48 in our country. 45 to 52 is the range. 54, if you are having regular periods without any other issues, if it is not very heavy, you're not bleeding in between periods, I would say fine. You keep yourself young, okay, by menstruating. I have a 61-year-old who is menstruating. I've got two women who are 56, 57, who are menstruating, 59 menstruating. So the maximum that I've seen, or who are with me now, is 61. So I'm not saying that it is very natural, but it is not, I mean, well, if you are menstruating regularly, if you have kept yourself under a gynecologist, no need to worry. You don't have to get your uterus out or do any other investigations.
So, doctor, you said in the menarche, less than 9 years is abnormal. Yes. For a person who's reaching menopausal, is there any less than, for example, less than 40 or less than 50?
Yeah, sorry, I skipped that point actually. I skipped that slide itself. Actually, yes, less than 40 is abnormal. It is called as premature menopause. Not only they can have symptoms of menopause, but their bone loss will be quite a bit. And by the age of 50, they can get into osteoporotic situation. So I think it's very important that we treat these women with premature menopause. So less than 40, yeah.
So that means as much as possible, it is good to delay the menopause.
Absolutely. Yeah. What happens? One caution about hysterectomy. Why do I keep saying that women should not unnecessarily have hysterectomy? They should avoid hysterectomy. Why do I say that? Because if we remove the womb, okay, 1 in 5 women, even if we preserve the ovaries, 1 in 5 women, the ovaries stop functioning for various reasons. So it is like attaining a premature menopause. So less than 40, I would very much hesitate to do a hysterectomy. And also less than 45 also, why should we reduce the opportunity of normal ovarian functioning for this woman. So if we cannot manage the periods with anything else, okay, I already told you, fibroids, you don't have to remove the uterus. Endometriosis, you don't have to remove the uterus. So there are so many things where you don't need to remove the uterus. So uterus is not a use and throw organ. Okay, it's not like a plastic bag. Okay, you carry babies and you throw it away. No, it is not like that, because it has a lot more functioning. There's a lot of communication between the ovaries and the uterus. So it's very important to preserve the uterus, and always take hysterectomy as the last resort for treating the menstrual issues or whatever is causing the menstrual issues. If it is cancer, yes, you don't have a choice. What do I want to say? So less than 40, the menopause, up to age of 45, we would like the ovaries to work. Longer it is working, you are going to look younger. Okay, longer the menopause, yeah, or more delayed the menopause, you are going to look younger, because the estrogens are still produced by the ovaries. Estrogen is the hormone which adds on the beauty to the woman.
So you gave a wow there. So
yeah, wow, yes,
yeah.
absolutely, yeah. Mhm.
Right. So, doctor, so that means if somebody is being advised in hysterectomy, it's always better they do a second opinion so that it helps them to give the right choice, right?
I am not encouraging shopping between
Oh,
doctors,
okay.
but I think it's very important to make sure that there are no other choice, and all the other choices have been exhausted before you remove the womb. That's why I gave that example. If a thorn is stuck to the toe, you don't want to remove the toe as a first thing. You want to see whether you can remove the thorn and do whatever is possible. So then if the toe is getting affected, yes.
So maybe two more questions, doctor. I hope because
Yeah, no problem.
Talking, yeah. So there's one question which is different. Is about vaginal dryness. I thought this is important because many people would be having. It's that how to overcome the itching in the vaginal area. So what can be done?
Yeah. See, vaginal dryness can be easily treated with an estrogen cream, which is applied into the vagina. Okay. And also, itching is not a very common symptom. Burning is a more common symptom of vaginal dryness. If you had itching with vaginal dryness or vaginal secretion also, then you have to make sure that you don't have a fungal infection. Fungal infection, that is the candida infection, thrush. Okay, if you fungal infection in that age group can come secondary to diabetes. So please check your sugar, make sure it is normal, and if there is fungal infection, get it treated, and avoid the dryness of vagina. Again, the dryness itself can make it more prone for infections. So make sure that you apply this estrogen cream into the vagina, which is really not harmful, because people think hormones, oh, there is a risk of cancer. No, not really. Okay. Yeah.
And after COVID, there are many women who are suffering from heavy menstrual bleeding, even in the age of maybe in the 40s. So what do you again prescribe them yoga and lifestyle modifications?
Yes, it is something to do. I mean, what is the cause for such menstrual bleeding is not very well analyzed. It could be hormonal changes due to stress, immunological changes due that the COVID has produced. Even vaccination can produce a lot of changes in the periods. So I would say lifestyle changes, but probably temporarily they might need some treatment. They don't have to get flustered about it. It might last for 3 to 6 months. Okay, so I think it's important if they're suffering to get it treated. And of course, lifestyle changes, especially yoga, will bring in a homeostasis or balance in the hormones and immune system.
So, doctor, one more question.
Finally, explain about perimenopause. Perimenopause is a phase of transition where your ovaries are producing less eggs. So periods can get irregular. You can have some menopausal symptoms, etc. Menopause is diagnosed only when one stops the period for 1 year, for an year, okay, without any other reason. For example, somebody might have put a medicated coil and they might not be having periods. That's not menopause. Ovaries should stop functioning for a year, which is, I mean, again, it is manifested as absence of period for 12 months. It's a retrospective diagnosis. So for this to happen, it goes through, the ovaries go through some changes, and that is hormonal changes can manifest as irregular menstruation and some menopausal symptoms, etc. That transitional phase, we call it as perimenopause, which can start even quite early. It can take few months to few years to go through menopause. Can we gain back muscle lost after menopause? Very, very important question. Very, very important. I forgot to tell you that there can be muscle weakness. In that list, it is there, but I didn't emphasize on it. Muscle weakness, people find it difficult to get up from the floor, sit on the floor after menopause. It is just not the bone weakness or anything like that. It is the muscle which gets weak. There is something called as sarcopenia. That is, the muscle mass reduces, muscle strength reduces after menopause. So we have to train our muscles, and we can gain back the muscle strength. Okay, so the muscles, I'm not sure whether it will reduce in numbers. I don't think so, but it is the strength of muscles, and it can be got back with exercises, with toning up, which is very important. That's why people lose balance after menopause, because the muscles are not working in coordination. The gait can alter, the balance can alter after menopause. Okay, so it's very important to train your muscles. I work as a, I work as an assistant professor of Government Degree College, 18th Cross. We have nearly 600 girls. Can you help with a session like this? Yeah, why not? Very much. That is the least that we can do to promote this vow. And we take a vow to do that.
So maybe they could connect to you with an email.
Yeah.
Doctor?
Yes. Yeah.
So I maybe, what is your email, doctor? I can maybe type it here.
Yeah. LATHA.
Okay.
VEN.
Okay.
KATARAM.
Okay.
@gmail.com.
Okay, so those whoever would like to, be connected with Latha ji, you could, always connect to her. And there are
due to late marriage, yes, madam. Just for clarification, absolutely true, madam. Single child, yeah, better to have. Yeah, single child is becoming very, very common. People give a lot of reasons to have single children, but I feel it is very important to have sibling for both mental and physical development of the other sibling. Okay, so, and also what can I say, mentally, single children, there are studies, yeah, they are, what can I say, the behavioral problems are also more. And psychiatric issues are also more. So it's better to have at least 2 children.
So, doctor, there are lots and lots of questions. I think maybe we should be having a second session. This calls for a second session, if it's okay for you. One of the days, maybe. I think there are so many questions about PCOS. I think PCOS and pregnancy. So the infertility issues and all that. A lot of women are having that problems right now. So maybe one of the days, if whenever you are,
I can take one session for question answer itself.
Oh, that's fantastic. Okay. I shall coordinate with you, doctor. I think because there are more very, very, very important questions there about bleeding, scanty bleeding, heavy bleeding, and I don't know, lower back ache and all that, but it's already 5:35 of your time. So because about a scanty bleeding, which occurs for 3 days, and there is and lower back ache for a 35-year-old for the past 5 months.
Sorry, come again. Sorry.
Oh, okay. It's a scanty bleeding, which happens only for 3 days, and there is lower back ache. I am 34-year-old, and this is happening for past 5 months.
Okay. Has she put on weight? Is she developing pimples? Is there a lot of hair growth? All these are very important. And is she under a lot of stress? How did she start having these scanty periods? All these are very important. Sometimes, I mean, not pertaining to this particular lady, but COVID time, last year we have had very many menstrual problems because of lot of stress in the family, bereavement, others going through COVID, and they themselves going through COVID. All these have really influenced periods negatively. And we had lots of consultations, outpatients and online consultations, unfortunately. So again, it is the hormonal milieu which is disturbed.
So for this person to understand what are the trigger points which is affecting the mental health, and then trying to understand with yoga and lifestyle changes.
And also they should check their thyroid, prolactin, and also is there any chance of premature cessation of periods, that is premature menopause. All these we have to keep in mind. But I think it is better they see a gynecologist and come to some conclusions or diagnosis.
I think, yes, like you said, doctor, it's we will have a second question answer session, because in YouTube also there are 2, 3, and I find every question very important. I feel really bad that I'm not able to take that. Somebody is asking about vaginal birth, if they have had a C-section in the beginning, and is it okay for vaginal birth?
They can, depends on what they have had it for and how this pregnancy is progressing and what is the presentation of the baby, that is whether it's keeping its head down around 36, 37 weeks. We will have to assess that, discuss, and 50 to 70% of them can have vaginal deliveries.
That's great news, because people who come to us for prenatal delivery, for the second one, they keep telling us that anyway, Prabha, it's going to be a C-section because I had a first C-section.
Once a section, always a section is not a dictum. Okay. So anyway, I didn't know that you had connected me to the, YouTube also, but anyway.
Yes, I've been taking questions from that also, so that prepare for those who are attending that side also. Those who felt that they need to look into this session, please go to our Yoga Bharati YouTube channel, and there's this session already there, and it would be there permanent. You could always Aram says sit again and go hear the points which the tips and suggestion which is suggested by doctor, because the retention ability is not very good for all of us. So after a few minutes you might forget what all has been told. So better to re-look onto this session.
Somebody has asked 40-year antidepressants over 10 years. Yeah, antidepressants can cause cessation of periods or scanty periods. It can make you put on weight, etc., etc. Stopping antidepressants is not an option, unfortunately, especially in your case, as you yourself have explained. But we can get you periods. That's important, and it is important to see a gynecologist to see what's happening to the ovaries, how are they functioning, etc., etc., and also what's happening to your thyroid and prolactin.
Okay.
Yeah.
That's a really high-spirited session we had, Doctor. It was a real wow session, to say exactly.
Yeah. Thank you. Thank you very much for all your patient hearing. Thank you. I've enjoyed talking to you. Many people have appreciated the talk. I'm very grateful to Prabha and her team and Yoga Bharati. Of course, Sri Raghuramji for encouraging me right from my adolescence, to go in this direction. So thank you very much. I'm very happy to be associated and do whatever is possible for women's health.
Thank you, Doctor. I would like to tell you all that Dr. Latha Venkatram is one of the board of advisory members of Yoga Bharati. And we are really hoping that we would have lots of interesting sessions whenever she's free and she's able to give her time on a Sunday evening like this. We would like to have whatever types of sessions you are interested, just do let us know so that we know that these types are what you are looking forward. And I could mention it to Dr. Latha and others. Next Saturday, we do have another session by Dr. Prabha. She's Dr. Prabha. She's an oncologist in Kidwai Memorial Cancer Hospital, and she wanted to share about cancer actually. So that is the idea. So she would confirm within a day or two regarding the time and date. So just join us in our YouTube WhatsApp group so that you're updated of all our events. So once again, I thank you a lot. Thanks a lot.
Namaste. Thank you.
We've been wanting for quite a long time since for the past so many months, and finally I'm so grateful that it has happened today. So thank you. Thanks a lot. And we'll end the session with Om Shanti Shanti. So let's all sit comfortably, be grateful for this wonderful day where we have been imparted with so many tips and suggestions. Let's do a sankalpa that we will take care of myself. That is, I would take care of myself in a very positive, holistic manner. I would take care and nourish myself, enrich myself. That needs to be my sankalpa so that I enrich and nourish others. Om Shanti Shanti Shanti. Thank you. Thank you so much. Thank you everyone for a wonderful question answer session, making it more and more informative for all the women here. Thank you. We would have one more question answer session, hopefully very, very soon, so that the spirit is still on. Okay. So thank you so much, Doctor. See you then.
Namaste.
Thank you.
Thank you.